All right, so here we have prolactin. What cells synthesize prolactin? Those are the lactotrophs. So what stimulates the production of prolactin in lactotrophs? Well, we know from the hypothalamus there is a hormone called TRH. So TRH will stimulate the lactotrophs to make prolactin. What about other stimuli? Not from the hypothalamus. Well, there's a really strong trigger, that is suckling. Suckling is a very strong trigger for lactotrophs to make prolactin. And what about others? There is pregnancy. So during pregnancy, why does prolactin um, be synthesized? That is estrogen. So we know estrogen will stimulate the lactotrophs to make prolactin. But here's a question. Why in pregnancy is there no milk production? Even though there's high amount of prolactin, why is there no milk production? Well, the answer is estrogen and increase in progesterone. What they're going to do is they will go to the breast tissue and they will downregulate prolactin receptors. So estrogen and progesterone, they downregulate the prolactin receptors, which makes prolactin pretty much useless when it, at least in terms of milk production, because there are no receptors for it to bind to. And lastly, we have crying. Crying is another stimulator for lactotrophs to start producing prolactin. What about inhibitors? There's a very strong inhibitor from hypothalamus that inhibits the lactotrophs, and that is dopamine. It's a big fat inhibitor. Okay, so let's take two hypothetical situations. Let's say there's a patient, we have a patient here, and we give him dopamine agonist. What do you think will happen to the prolactin levels? So if we give him dopamine agonist, that will decrease the amount of prolactin. Okay, now let's take the opposite. Let's say we have another person here, and we give him antagonist. What if we give this person antagonist? What happens to prolactin? Does it increase or does it decrease? Well, obviously it should be increase. Why does it increase? Because let's say this is dopamine receptor, it will bind to the dopamine antagonist. The antagonist will bind to this receptor and prevent dopamine from attaching to this receptor. So then that means dopamine cannot have its effect, right, on the lactotrophs, therefore increasing prolactin. What about the functions? What are the functions of prolactin? So it has three major functions. First one is breast development. So during puberty, prolactin combined with estrogen and progesterone help with the breast development. And second function is lactogenesis, which is milk production. And Lastly, there is inhibition of ovulation. So why is there inhibition of ovulation? Well, answer is simple. Prolactin makes its way to the hypothalamus, and um, it inhibits the production of GnRH. So if there's no GnRH, there is no FSH and LH. And that means no ovulation. Thank you very much for watching this video. And if you found it helpful, make sure to like and subscribe and share with someone who might be struggling in this topic. Go make their day.